Hello, everyone. Welcome back to the Healthcare and Healing Podcast. I'm Crystal.
I'm Isabel.
I'm Dana.
I'm Kira.
I'm Rose.
And I'm Molly.
So last episode, we discussed the responses of different European nations to the second wave of the coronavirus pandemic. Today, we will be talking about centralized versus decentralized government responses to the COVID-19 pandemic exhibited by each country, weighing the benefits and the consequences of each. This was a question we came back to time and time again in our research. Is it better to have a more centralized or decentralized system in the face of a pandemic? So to start, let's get a bit of a background on what centralized versus decentralized government actually looks like. So the first question I have is your country's healthcare system more centralized or decentralized? Dana, would you like to start us off with Italy?
Sure, Crystal. So Italy has one of the more decentralized healthcare systems of the bunch. Because there's such a large divide culturally and economically between the northern and southern regions, it made sense to set up a healthcare system that took advantage of that. All regions are in control of how their healthcare is provided, as well as how much money of the regional budget is allocated toward this healthcare system.
As I mentioned in previous podcasts, Spain has 17 autonomous communities, and each of these autonomous communities has its own distinct culture, flag, geography, cuisine, and in some cases, even language or dialect. So in recent years, Spain's government has had a pretty difficult time trying to unite and manage regions that are so dissimilar. The lack of unity at the national level is also seen in the Spanish healthcare system. So Spain's healthcare system is highly decentralized, meaning that each autonomous community is primarily responsible for its management and delivery of healthcare services.
So in contrast to Italy and Spain, France has a very much more centralized healthcare system. And although the government does not regulate choice, the central government of France has a great deal of control over the healthcare system in general. So the government regulates healthcare costs, they set the new guidelines for budgets, and they set the national health strategy through an annual parliament vote as well.
I think Lithuania is rather middle of the road in terms of centralization. There have been great efforts to decentralize the government since Lithuania declared independence from the Soviet Union in the 1990s. And the 10 regions have been given a certain degree of autonomy in regards to healthcare. But the central government, made up of the president, prime minister, and the Seimas, the Lithuanian Senate, still maintain significant power over healthcare decisions.
I would definitely say the UK fits with Lithuania in terms of middle of the road side of healthcare system centralization. Most of the funding is nationally based, which provides a basis of centralization. But the healthcare system is effectively made up of 4 separate healthcare systems in the regions of England, Scotland, Wales, and Northern Ireland.
So for Germany, it's a little bit difficult, I think, to characterize their healthcare system. So overall, Germany is a federalized state. So it's a fairly decentralized country. They have a chancellor in 16 states composing the country. And for the healthcare system on the federal level, there is the German Ministry of Health as well as the Federal Joint Committee. However, they don't really have power in the delivery of care. They kind of defer that delivery to non-governmental organizations called sickness funds. So the decision-making powers are a little bit difficult to decipher within Germany, which leads to a little bit of territory-specific regulations being involved in terms of lockdown procedures.
Thank you all for giving kind of a bit of a background on how the healthcare system seems to be in terms of centralization and decentralization. And something going off of that really interested me was your country's response to the pandemic more centralized or decentralized? And does this correlate with their healthcare system, how it originally was? Dana, would you like to start us off again?
Yeah, so I think I've kind of mentioned this in previous episodes, but Italy started off the pandemic in a very decentralized way, with each region deciding when to go into lockdown and how strict these restrictions were. When this failed to slow the infection rate, the central government kind of took over and made blanket statements and decrees that applied to the whole country. While this was successful in initially slowing the spread of COVID, it made citizens in certain regions unhappy that were less affected by COVID, and this unhappiness has grown in some regions that have recovered quicker than others due to the effects of the pandemic.
Like Italy, Spain initially allowed its autonomous communities to decide whether to enforce travel restrictions and stay-at-home orders. However, after the state of alarm was announced on March 14th, all Spaniards, with the exception of essential workers, were required to stay at home. Additionally, Spain's prime minister gave the Minister of Health authority to do what was necessary to reinforce the Sistema Nacional de Salud, so the public healthcare system. During the second and the future third wave of the pandemic, Spain's response became increasingly decentralized. Besides a nationwide curfew, each autonomous community was responsible for enforcing its own COVID-19 restrictions.
So again, very much unlike Italy and Spain, the pandemic response of France was very centralized. So France established a COVID-19 scientific council, which was made up of members from many different backgrounds, some of the backgrounds including epidemiology and infectious diseases. And these people gave advice to the French government on limiting the spread of the pandemic, and the government would then make policy decisions based on this advice. So the French government itself had taken control over policy decisions surrounding COVID-19. This was in order to react fast to the different waves. So the government at this point implemented restrictive measures at the local level without the advisement of local authorities.
Although healthcare administration is decentralized, the Lithuanians' response to COVID-19 was entirely centralized. Policy decisions were made by the Minister of Health and enacted nationwide.
Yeah, along with Lithuania, while the healthcare system in the UK does have some variation, the response was definitely very centralized in how public funds were made available and how lockdowns were, at least initially, enforced.
And for Germany, it seemed to be a little bit of a battle between the chancellor trying to push a centralized approach and individual states trying to make a more individualized approach for what was best for their individual regions.
So kind of going off of this question that we just answered, and we've kind of mentioned some of these benefits and consequences already, but my question for you all is, what are the benefits and consequences of both of these approaches, whether that be centralized or decentralized?
So I would say for Italy, the benefits of having a decentralized system could be seen before the pandemic, when each region could supply what it needed and provide for its specific group of people. Unfortunately, there's not really a great communication network set up between the regions, and this left parts of Italy very vulnerable during the pandemic. So I would definitely say total and complete decentralization is not the perfect way to go.
Yeah, I agree with a lot of Dana's observations about Italy. The decentralized approach in Spain certainly led to quite a few governmental disputes and a general lack of accountability. One benefit of the decentralized approach, however, is that Spanish islands with low COVID case counts were not required to shut down with the rest of the country. Spain's decentralized response certainly gave each autonomous community the freedom to choose whether to take action. And I guess that can be seen in a positive and negative way.
Yeah, so the benefits of the decentralized system that Dana and Isabel just described towards Spain and Italy really go with the consequences of having a very central response, in that the centralized response overlooked local healthcare situations and variations between different regions in France. So, but for beneficial reasons, the strong central response was beneficial in that there was one source of information being released on a national level to the public by the government, which was helpful in terms of the French citizens knowing which regulations they had to follow and preventing confusion. And another and final question that I have for everyone is, do you have any recommendations for the government based on the way that centralization and decentralization has been enacted in their COVID-19 response?
Yeah, so I can start us off. So I think for Germany specifically, and for a lot of countries, there's plenty to be learned from the pandemic. So I'd recommend that government officials use this experience as a way to prepare for future outbreaks and crisis situations. And ultimately, when directing the public on safety measures, they need to make sure the information is disseminated clearly without contradiction, which is something I think we saw in Germany a little bit. with the chancellor pushing for a unified approach and individual countries trying to push, individual regions trying to push individual guidelines. So the threat of the pandemic shouldn't be undersold to citizens at any point.
Yeah, going off that, I think that the UK also mainly needs to focus on preparation. The system of centralized funding with regional healthcare systems worked well in giving the systems what they needed as they went, but without adequate preparation of gathering PPE and enacting a pandemic plan immediately, the healthcare system simply couldn't keep up with the demand until these issues were resolved.
Yeah, exactly. And while I'm certainly not an expert on any of this, one recommendation I would make is to form a system that's a little bit more flexible. COVID spread so quickly throughout Italy because the government really had no way of consolidating all of the regions into one system, which led to poor communication and unclear leadership. So I think a decentralized system works for the country, but in times of crisis, such as a pandemic, there should be a way for the government to assume control and unite the country and its healthcare system together to prevent these disasters from growing and getting worse.
Yeah, I believe that the decentralized approach to the pandemic in Spain contributed to the division and the regional animosity in the country. That said, a decentralized approach was fitting in the cases of Spanish islands off mainland Europe. My recommendation would be to start with a decentralized approach and to finish with a decentralized reopening, meaning that certain regions could decide when they wanted to lift restrictions. There is a lack of unity in Spain, and I think that the country would benefit from a concerted effort against the common enemy of COVID-19.
For the centralized approach that France had to the pandemic, I think it underscored the need for improving local coordination of care provision. So my recommendation would be for the government to make policies in conjunction with authorities on the local level who understand the local situation with expertise in the future. This will ensure that local problems are not overlooked and solutions can be developed on the local level to create effective policy measures.
Yeah, I definitely agree with Crystal. In Lithuania's case, there were two issues with the centralized response, including a small number of decision makers and general mistrust in the government. To combat these two issues, I recommend that the government make sure that decision makers are the best qualified to make the decisions. In Lithuania's case, an epidemiologist should have had like a clear role in decision making. Building off that, transparency is absolutely critical in a centralized government. The pandemic resulted in so much fear and uncertainty that nobody knew who to trust. And if the government is, making major decisions that affect daily lives and healthcare, they should be very clear about who is making the decisions and what authority they have to do so.
Thank you all for your responses today. And we just want to say a big thank you to all who are listening to this podcast episode today. We hope you have learned more about centralization and decentralization of each country's response played, or how it played a big role in the effects that the pandemic had on the population, as well as the recommendations that we have for each government. Don't forget to listen to our next and final episode, which will talk about the recovery of each healthcare system from the COVID-19 pandemic. Thanks for listening.